Okay, so good afternoon to all of you. Is my voice clear or audible? We are going to discuss diarrheal disease. So, in epidemiology of diarrheal disease, WHO defines diarrhea as the passing of liquid or watery stool. So, here, first of all, consistency of stool is important. Stool should be liquid or watery stool at least 3 times a day in 24-hour period. So remember that consistency of the stool is important rather than the number of stool, right? So more important is consistency. So it should be liquid or watery stool at least 3 times a day. That is definition of diarrhea given by WHO. Clinically, this is classified as acute diarrheal disease and chronic diarrheal disease. So WHO defines acute diarrhea as an attack of sudden onset, which lasts for 3 to 7 days. So acute is short-lived for 3 to 7 days, right? While chronic diarrhea is lasting for 3 weeks or more. Acute diarrhea is for 3 to 7 days, that is maximum 1 week. Sudden attack, while chronic diarrhea is lasting for 3 weeks or more. So diarrhea can cause, because of the diarrhea, as you know, that there is fluid loss. So it can cause dehydration, which means the body lacks enough fluid to function properly. So diarrhea is loss. Diarrhea will be causing dehydration, that is loss of fluid from body. So because of the loss of fluid from the body cannot function properly. That is dehydration condition. Dehydration is particularly dangerous in children and in elderly people. Average adult has bout of diarrhea about 4 times a year. So it may be possible that 4 times in adult life in during a year, a person can get diarrheal disease. So diarrhea is leading cause of illness and death among children. So in children, particularly in under 5 age group children, diarrhea is one of the leading cause of illness. You know that frequently children suffer diarrhea more than the adult, and because of the diarrheal disease, there are more death in under 5 children as compared to adult in developing country. So children are likely more than the adult to die from diarrheal cause because of the dehydration, because they suffer dehydration more quickly, right? So in death in children, death due to diarrhea is more because they suffer dehydration more quickly than adults. So dehydration in children, a child may lose almost as much as water and electrolyte from the body during the episode of diarrhea as an adult. Since the length and surface area of the intestinal mucosa of a child where diarrheal fluid are lost are as large in adult, right? So a child can even lose water and electrolyte, that is as compared to the adult, right? Loss of 1 liter of the fluid from the body of a child weighing 7 kg is more hazardous than a person of 70 kg, right? We have already said in this statement that children lose fluid equal to the adult, but what happens that the weight of the child is less as compared to the weight of the adult. So if 1 liter of the fluid is lost from the child as compared to the adult, so child suffer from severe dehydration. Child suffer from adverse effect severely due to dehydration as compared to adults. So this dehydration is more dangerous in children as compared to adults. Mortality due to diarrhea. So acute diarrhea is revealed and important only by respiratory infection as a cause of morbidity in worldwide. So diarrhea is important as a cause of mortality. We have already discussed in previous slide. So you can see that mortality due to diarrhea by 2000, no need to remember this data. So proportion mortality, you can see that diarrhea, this is the color, 13% of the death is due to diarrhea worldwide, right? Again in 2002 it was 15%. So Before the WHO initiated diarrheal disease control program, approximately 4.6 million children were dying each year because of the dehydration caused by diarrhea. 4.6 million, that is 46 lakh children under 5 age group were dying before the introduction of the diarrheal disease control program. Oral rehydration salt, you know, ORS, and oral rehydration therapy, that is ORT. It was adopted by WHO and UNICEF in 1970 and have been successful in helping and management of the diarrhea among children. So this is most important thing, most important invention of the 20th century. Oral rehydration therapy in form of oral rehydration salt. It has prevented millions of deaths due to diarrheal disease. So the mortality rate for children under 5 suffering from acute diarrhea has fallen from 4.5 million to 1.6 million. Right? Still, acute diarrhea continues to be a high. It continues to be a more problem in developing country. Right? It exerts a high toll of the children in developing country. Means it is a major public health problem in still in developing country, including India. So these are all data. I'm not going to discuss of that. 80% of these children die in first 2 years of the life. The children who die in due to diarrheal disease in under 5 age group, among them 80% die within 2 years, first 2 years of the life. Right? About 42,000 children die in a week and 6,000 in a day. So 4 children every minute die in India because of the diarrheal disease. No need to go to the data. Daily loss, we will skip it. So agent factor for diarrhea. Diarrhea is caused by viruses, bacteria, and others. So common virus, most common virus, you need to remember this first one, rotavirus. In children, diarrhea is most commonly due to this rotavirus infection. That is the most common agent causing diarrheal disease under 5 children. Other viruses like astrovirus, adenovirus, calcivirus, coronavirus, you can see the name over here, right? It is also causing diarrhea. So you can see that coronavirus in many patients of the COVID, suffering from the COVID, this coronavirus is also causing diarrhea, right? Enterovirus is, so most important you remember is rotavirus. In bacteria, Camelobacter jejuni, E. coli, Shigella, Salmonella, Vibrio cholera causing cholera, Salmonella causing typhoid, Shigella causing bacillary dysentery. This is causing cholera, Bacillus cereus. These are the leading names of bacteria which cause diarrheal disease. Others like Entamoeba histolytica, Giardia, Trichuriasis, intestinal worms, oral causing diarrheal disease like other agent. So try to remember the names of the agent which cause diarrhea, right? Persistent diarrhea is one of the main clinical sign of AIDS in tropical countries. So diarrhea, one of the important sign of AIDS, that is diarrhea more than 1 month, right? That is one of the important clinical sign of HIV/AIDS. Children with measles run a high risk of developing severe fatal diarrhea. So one of the complication of measles is also diarrhea. So in HIV, diarrhea can be seen. In measles, diarrhea can be seen. Person who is having coronavirus infection, few of the persons may be suffering from diarrhea. We have already discussed about this bacteria and viruses causing diarrhea. So here percentage are given. No need to remember percentage. Most important, you remember that rotavirus are important cause of diarrhea in children, under 5 children. Others are E. coli, Shigella, Camelobacter jejuni, this Vibrio cholera. These are other causes of diarrhea. Rotavirus, it was first discovered in 1973. It has emerged as a single most important cause of diarrhea in infant and children. Remember this. Right? In South India, 20 to 66% of the hospitalized case of diarrhea are associated with rotavirus, according to study conducted. Shigella, it's also a major cause of diarrhea in India. Right? So just remember that, no need to go through the data. Salmonella and Vibrio, that is also there. So we are both are endemic in India. Salmonella is causing typhoid, Salmonella typhi, and Vibrio cholera is causing cholera. Right. So these are also one of the important cause of diarrhea. some of the history of epidemic of diarrhea in 2001 Orissa, right? Then 2003 and 4 epidemic investigation in West Bengal, right? So no need to go to the detail in the studies. Diarrhea may be caused by parenteral infection also, right? So parenteral, that is injectable route, right? Malnutrition may lead to certain nutritional disease which are associated with the diarrhea. So a child suffering from malnutrition has more chance of suffering from diarrhea also. Diarrhea in newborn is unusual and may be due to inborn errors of metabolism such as organic this congenital enzyme deficiency. So that is inborn error of metabolism in newborn. Diarrhea is cause. Reservoir of the infection. Man is the reservoir of the infection for E. coli, for Shigella, Vibrio cholera, and Giardia. While human and animal feces, these are for Camelobacter jejuni and Salmonella. So reservoir of the infection, you know the meaning very well. Host factor. So age. Most commonly, this diarrhea is seen between 6 months to 2 years of age, right? But you can say that broadly under 5 age group is most common age group for diarrhea. You can broadly remember like that, right? And among them also 6 months to 2 years is most common. Incidence is highest in age group 6 to 11 months when weaning occurs, right? Weaning, you know that that is slowly changing over from breast milk to supplementary feeding, that is weaning. So at that time incidence of the diarrhea is highest. So diarrhea is most common in malnourished children, right? Vicious cycle. So malnutrition leads to infection. You know that because of the malnutrition immunity will decrease, right? And decreased immunity will lead to more chance of infection, and this infection will lead to diarrhea. Infection we have already seen: rotavirus infection, Vibrio cholera, Camelobacter jejuni, and this diarrhea will again lead to loss of fluid, loss of appetite, and that is leading to malnutrition. Malnutrition will lead to infection. So that is called vicious cycle: malnutrition, infection, and diarrhea. So this is vicious cycle. Contributing factor: poverty. So in poor people, diarrhea is more than common in their children. Incorrect feeding practices like using of the infant feeding bottle, because this bottle is infectious. Bottle may not be washed properly. So as you know that infant feeding bottle, it has been prohibited, right? It is not to be used, right? Prematurity in children who are premature, more chances of diarrhea. Immunodeficiency, right? Immunodeficiency will lead to infection, and infection will lead to diarrhea. Lack of personal and domestic hygiene, most important, personal hygiene, right? Lack of personal hygiene, like that not washing hand before eating, not washing hand after defecation, right? Not having the bath daily. So these are lack of personal hygiene which can lead to the more chance of infection, and due to that diarrhea will be more common. Environmental factor: although diarrhea occurs at any time during the year, but outbreak of the diarrhea follow seasonal pattern, right? In most developing country, cholera diarrhea due to cholera is more common in winter. Rotavirus diarrhea is also in winter, while Shigella, that is bacillary dysentery, in dry summer. So in winter, cholera and rotavirus are more common. Mode of transmission. So all these are the mode of transmission. Fecal-oral, that is fecal-oral, that many of the bacteria are secreted in fecal route, and if it comes into the contact of the hand, and if our hand comes into the contact of our mouth, that is called fecal-oral route. It may be waterborne, foodborne. So waterborne, diarrheal disease causing agent are present in water, so it is waterborne. Foodborne, right? Or direct transmission to finger, fomites, and dirt, right? So these are all modes of transmission. So many modes of transmission for diarrheal disease. Again I repeat: fecal-oral route, waterborne, foodborne, direct transmission, fingers, fomites, dirt, right? So try to remember this. I am keeping in front of you. Okay, so that was just introduction, but I am sharing another presentation. The topic is not over. That was just epidemiology of diarrhea. I am sharing another slide. Till then, you write down in chat box what are the causative agents of diarrhea? You write down in chat box what are the causative agent of diarrhea. Write down in chat box till I share another presentation. Write down the names of causative agents of diarrhea. Yes, I am waiting for your reply. What are the causative agents of diarrheal disease? Which bacteria or viruses cause diarrhea? I have asked that. Yes, rotavirus, most common, very good. Shigella, E. coli, coronavirus, yes, very good. What is the most common age group for diarrheal disease? Most common age group for diarrheal disease? Okay, other students have also replied rotavirus, Shigella, Vibrio cholera, very good. E. coli. What is the most common age group for diarrheal disease? Under 5 age group, very good. Okay, now we are going with clinical features and diagnosis. So let me select the pointer. So this definition and everything we have already discussed, so I will not go into the detail. Breastfed infant pass soft semi-solid stool, and hence the change in consistency and character of the stool is more important. That is same over here. So, four clinical types of diarrhea recognize. Acute diarrhea. We have already known that acute and chronic. So, it involves passage of loose watery stool without visible blood. Here, vomiting and fever may be also present. So, most important clinical feature in acute watery diarrhea: loose watery stool without visible blood, and vomiting and fever may be present. Duration is less than 14 days. It results in dehydration and undernutrition. Right. So, common agent for this acute diarrhea are rotavirus again, E. coli, Shigella, Vibrio cholera, and Salmonella typhi. Then acute bloody diarrhea. This was acute watery diarrhea. Now acute bloody. So name itself suggests bloody. So it involves diarrhea with visible blood in feces. Right. Here complication of this diarrhea are anorexia, rapid weight loss, sepsis, and damage to intestinal mucosa. Agent for this acute bloody diarrhea are Camelobacter jejuni and Shigella. Right. So bacillary dysentery. Shigella is causing what? Bacillary dysentery. So in dysentery, blood and mucus may be also seen in the stool. Right. Persistent diarrhea, as the name suggests, it lasts for 14 days or longer. It may be acute watery or bloody diarrhea. Right. Complication of the persistent diarrhea include marked weight loss and risk of dehydration. Right. No single microbe is responsible for this persistent diarrhea. It may be a mixture of the infection, but Cryptosporidia may play a major role. Then chronic diarrhea. It refers to the recurrent or long-lasting diarrhea due to non-infective cause like gluten insensitivity, and should not be confused with the chronic diarrhea. So here chronic diarrhea, it includes non-infective cause like gluten insensitivity. So we have seen four types of the diarrhea: acute watery diarrhea, acute bloody diarrhea, persistent, and chronic diarrhea. Diarrhea with severe malnutrition. So diarrhea can be associated with the condition like marasmus and kwashiorkor. We have already seen that malnutrition, infection, and diarrhea is a vicious cycle. So reason for this are nutrient intake decline as much as 1/3 during the first few days. Right? So diarrhea can lead to the decrease in nutrient intake because of the loss of appetite, because of the anorexia. And loss of nutrient will lead to the diarrhea. Due to diarrhea and vomiting, and nutrient absorption is also decreased, so it will lead to malnutrition. So we are discussing what? That how diarrhea leads to malnutrition. Because of the diarrhea, there can be less nutrient intake, less nutrient absorption, and nutrient will be lost in diarrhea and vomiting, so it will lead to the malnutrition. Complication of this were severe systemic infection, dehydration, deficiency status, and heart failure. So vicious cycle again, this is same. Predisposition, small intestinal dysfunction, right? Because of the chronic diarrhea, there can be malnutrition. Malnutrition lead to pancreatic and gastric dysfunction. Malnutrition lead to the deficiency of the specific element like zinc. So zinc is added. Zinc is used in a therapy of the diarrhea. Zinc tablet is given who is suffering from diarrhea. Along with the ORS, zinc is also given. Right. So this etiology, it is all we have discussed. So I'm not repeating that part. Right. I will not. One more thing is to say that in chronic diarrhea, parasite may be also there. Worms and amoeba, right? They are also one of the part of the immune etiology. We have already seen this, so I'm not repeating that. Pathophysiology: amount of the fluid present in the bowel is around 6 to 9 liter, right? But most of this is reabsorbed, and stool contain 100 to 200 ml per day fluid, right? Complication are due to complication of the diarrhea due to loss of water and salt in the stool. So it is dehydration. This is called dehydration. Fluid is lost from the bloodstream. So heart compensate by beating faster. So there will be tachycardia. Tachycardia is complication because fluid is lost. So in order to compensate the lost fluid, heart beats faster. So it is causing tachycardia. Fluid is also drawn from the body, tissue, and circulation to essential area. Limbs become cold and pulse become weak. So in diarrhea, because of the fluid loss, there will be loss of the fluid from the circulation. So our pulse become weak, right? Limbs become cold, right? Circulation collapse. Urine volume decreases as there is loss of the fluid. Consciousness is impaired, right? Severe diarrhea, severe dehydration related to the unconsciousness. In cholera, there will be also acid-base imbalance, right? And acidosis can occur. Again, I repeat, pathophysiology of diarrhea. This is here complications are due to dehydration, right? Tachycardia because of the loss of the fluid from circulation. Fluid is all lost, and so that limb become cold and pulse become weak. Circulatory collapse, urine volume decreases, consciousness is impaired, and acid-base balance is impaired in cholera. No need to go into other detail. Clinical feature during diarrhea, there is increase in loss of water and electrolyte. If it is not replaced, it will lead to dehydration, and symptoms of dehydration include what? So here, these symptoms are mentioned. So degree of the dehydration is according to, the symptoms are according to early or mild dehydration, moderate to severe dehydration, and severe dehydration. So in early or mild dehydration, there can be extreme thirst. Whenever there is dehydration, loss of the fluid from the body, you feel thirst. So here extreme thirst. Decreased urine output, weakness, cramping, irritability, person become irritable, warm and dry skin because the fluid is lost from the skin. So dry skin, crying with few or no tears. Child may cry, but tears will be very less. Dizziness, dry mouth and tongue. So these are the signs of mild dehydration. Moderate dehydration, low blood pressure, sunken fontanelle. You know that in children, the fontanelle are there, anterior and posterior fontanelle are there. So these fontanelle are sunken in case of the child, and dry eyes, sunken eyes, where we can rather say dry eyes also, but sunken eyes. Akho under utri gayo હોય તેવું લાગે. That is called sunken eyes, sunken fontanelle. Wrinkled, inelastic skin, right? Skin become wrinkled. In place of the smooth skin become wrinkled, inelastic, loss of elasticity. If you pinch the skin, you know that if by pinching the skin, just I am showing you. So if you pinch the skin, it goes back fast, right? If you pinch the skin, pinch your skin, all of you will pinch your skin, it will go fast, right? But in case of the child, if you pinch the skin, it will slowly go back. Who is suffering from dehydration, the child who is suffering from dehydration, any person who is suffering from dehydration, severe dehydration, If you pinch the skin, it will slowly go back. That is called, that is loss of, that is due to loss of elasticity of the skin. In severe dehydration, so some more thing is remaining in moderate to severe: rapid and deep breathing, fast weak pulse. Severe dehydration, these effects are more pronounced. More loss of elasticity, blood pressure further falls, sunken eyes, very much sunken eyes, rapid breathing, fast weak pulse, right? And hypovolemic shock or death may occur because of the severe dehydration. So I'm keeping this in front of you. Try to remember the signs of dehydration. This is most important part of the topic. Grading of diarrhea due to according to dehydration signs. Right? Remember this part. This is most important part. Okay, mention this condition in chat box. What you have remembered? What are the signs of dehydration? Mention this. What are the signs of dehydration in general? If you cannot not mention in according to the mild, moderate, severe, mention what you have remembered, what you have understood. What are the signs of dehydration? Mention in chat box. Write down in chat box what are the signs of dehydration. Dry tongue and mouth, sunken eyes, very good. Okay. What other signs? Dry lips. Okay. Which other signs of dehydration? Extreme thirst, cramping, wrinkled skin, very good. Elasticity, loss of elasticity, sunken eyes. Okay. Then which other signs? What happens to blood pressure? Weakness, extreme thirst, decreased urine output, yes, rapid pulse, decrease in elasticity, dry tongue, very good. Decrease urine output. What happens to blood pressure? Okay, blood pressure, low blood pressure, very good. Okay, so now we are going further. So assessment of the dehydration, that is also similar. So whenever a child is suffering from diarrhea, we want to see that whether there is dehydration or not, or if there is dehydration, then it can be some dehydration or severe dehydration. Again, that can be repetition, but it will be helpful. So in case of the no dehydration, child will be well alert, eyes are normal, tears are present, tongue and mouth will be moist, as it is there in our mouth also. You can see that our mouth is moist, tongue is moist, right? Vini oichem. Thirst, child drinks normally and not thirsty, so no dehydration. And skin pinch, if you pinch the skin, it goes back slowly, it goes back quickly, sorry, it goes back quickly. In case of some dehydration, child will be restless and irritable, eyes sunken, tears are absent, dry mouth, thirsty, and drinks eagerly. If you give water to the child drinks eagerly. And pinching the skin will go back slowly. In severe dehydration, condition is lethargic, unconscious, floppy, lethargic condition. The child will not be active. If you keep the child over the bed, child will be sleeping without any activity. Right? Very sunken eyes and dry eyes. Right? Tears are absent, very dry, very much dry tongue and mouth, thirst, so drink poorly and not able to drink, right? The child drinks very poorly, child is not even able, even the child is thirsty but not able to drink in case of the severe dehydration. And on skin pinch, this goes back very slowly because of the loss of elasticity. So I'm keeping this in front of you. Try to remember this. Try to remember signs of some and severe dehydration. Okay. Seriously dehydrated child, right? So you can see that running belly can make your baby dry up. Sunken eyes, sunken mole, right? Dry mouth, loss of water, child stop playing. No need to discuss this part. Rotavirus, viral gastroenteritis, these are all part of the diarrheal causes. You know, the adenovirus, coronavirus, right? In Vellore, it has been reported previously. Viruses, we will just remember the names of the viruses. No need to go into the other detail. This you already know that bacterial causes of the diarrhea, so no need to go into the detail of this. And there are some types of the enterotoxigenic E. coli. This is enterotoxigenic E. coli, enteropathogenic E. coli, enteroinvasive E. coli. These are the types of E. coli. Just remember this: enteropathogenic, enteroinvasive, enterotoxigenic. No need to go into the other detail. These are E. coli. Whatever important at UG level, that will I will only discuss. Right? Giardia. This is diagram of Giardia lambia and Croptosporidia. Traveler's diarrhea. That is what? That is 3 to form unformed stool in 24 hours and at least one enteric symptom like fecal urgency, abdominal pain, or vomiting. That is traveler's diarrhea. It is acute in onset, but might become chronic if untreated. Pathogenesis is depending upon the organism. Right? Most commonly, this traveler diarrhea is also by E. coli. Right? No need to go to other details. Etiology of traveling diarrhea, enterotoxigenic E. coli. Just remember this. Etiology of traveler's diarrhea. The STD is what? Traveler's diarrhea. Most commonly, it is caused by enterotoxigenic E. coli. We have already seen that one of the important sign of diarrhea is one of the important sign of AIDS is also diarrhea. Right? Persistent diarrhea is seen in patient with AIDS. And there can be hospital-acquired diarrhea because of the hospital-acquired infection. Food poisoning, that is also one of the common cause of diarrhea. It is an acute gastroenteritis caused by ingestion of the food or drink which is contaminated. Most commonly, we see that our food, outside food, is maybe there are more chances that it may be contaminated with the bacteria who can cause diarrhea. Right? So it may lead to gastroenteritis. So salmonella food poisoning is very common in developing country, right? Other food poisoning, staphylococcal food poisoning. Here, onset of the symptom will be within 6 hours of the ingestion of the food. You may have heard in newspaper that after eating food in a common party or some social functions, many of the persons are suffering from diarrhea or vomiting. So in this type of the food poisoning, staphylococcus, salmonella, they are the common cause. Most commonly, staphylococcal, if if it is onset of the symptom is within 6 hours of the ingestion of the food. Others are botulism causing Clostridia perfringi, Bacillus cereus. Right? These are other agents who can cause food poisoning. Lab diagnosis, it is available at the primary health center, right, with immediate referral. So here specimen can be collected, stool specimen. This is required for diagnosis of the type of the agent which is causing this diarrhea. A water specimen can be also used. Collection of the food samples, suspected food may be used, right, for collection and sent for analysis. So transportation is Stewart or Kerry Blair media, right? It is used for transport media. Uh, Laboratory examination, microscopic examination of the sample, right? You can use different type of the microscopic that type of the stain for identifying the organism. Apart from the microscopic examination, culture is also used for laboratory diagnosis. So that is all about laboratory diagnosis. Still, we have to complete prevention and control. So I am sharing another presentation, last presentation, that is on prevention and control. So till then wait and write down the what are the signs of severe dehydration. Just write down signs of severe dehydration till I share another presentation. What are the signs of severe dehydration? Write down in chat box. Yes, hypovolemic shock, lethargy. Okay. What happens to eyes? What happens to eyes? Fontanelli, ability of the drinking, unconscious, skin elasticity is lost. Very good. Eyes are very much sunken, right? Fontanelli is open, sunken. Okay, now prevention and control of diarrheal disease, right? So diarrhea, this whole thing we have already discussed. Just a second, wait. The diarrheal disease control program of the WHO has it was initiated in 1980, right, and advocated several intervention. You know that most important is oral rehydration therapy. That is most important step or most important invention of 2020. We can say it has saved many of the children. Component of the diarrheal disease control program, this may be short term or long term, right? So short term is appropriate clinical management by using oral rehydration therapy. You know that oral rehydration powder, ORS powder, you may have also used it in your home. And there is also homemade solution which is by using this salt and water. Salt, sugar and water is used for making the home based solution. One pinch of the salt, one fist of the sugar, and boiled water is used for 1 glass of the ORS. So this oral rehydration therapy is cheap, simple, and effective. So effective way to control the dehydration due to diarrhea. Right? So ORS is given to all the children who is suffering from less than 5 years of the age of diarrhea. So here for homemade ORS solution, 8 teaspoonful of the sugar, 1 teaspoonful of the salt. So salt is more required. Or simply remember that 1 pinch of the salt and one fist of the sugar is used for making the ORS solution of the 1 liter of the water. This water is also to be boiled before making the ORS. In also packet ORS, whatever ORS you are adding to the water, this water should be first of all boiled and cooled, and then whole packet is to be dissolved into the ORS into the water to make the 1 liter of the solution, which is to be which is to be used within 24 hours. So ORS is composed of bicarbonate, citrate, right? There is also inclusion of the trisodium citrate to make the ORS solution more stable. Right? ORS results in less stool output. Whenever you give the ORS, it will control diarrheal episode. It will result in less stool output. Right? So these are the ingredients of the ORS: sodium chloride, sodium bicarbonate, potassium chloride, and glucose. Remember this ORS component of the ORS: sodium chloride 3.5 gram, sodium bicarbonate 2.5 gram, potassium chloride 1.5 gram, and glucose 20 gram per liter of the water. In new ORS, content of the glucose has been reduced to 13.5 gram. So remember names first of all: sodium chloride, sodium bicarbonate, potassium chloride, 2 chloride, sodium chloride and potassium chloride, then sodium bicarbonate and glucose. Right? This is millimole per liter. So For ORS solution, this is also one of the screenshot of the WHO recommended this formula, orange flavor. There are many flavor available for ORS solution for liking of the child. So what ORS does, it will decrease the loss of the fluid from the lumen, right? Glucose will decrease, sodium will decrease. In ORS, you can see that there is presence of sodium. So sodium will decrease the loss of the fluid from the lumen. So diarrheal episode decreases. So this is also same. I'm not going to read that part. That is the dose of the ORS in less than 4-month child. If the weight is less than 5 kg, then 200 to 400 ml of the ORS should be given within 24 hours. As the child age and weight increases, you know the dose of the ORS increases up to 4,000 ml per day. That is 4 liter per day. In case of the child who is weighing less than 15 years and having greater than 30 kg weight, up to 4,000 ml, that is 4 liter of the ORS can be given within 24 hours. So for preparation of the ORS solution, first of all, mother should wash the hand with the soap and water before preparation of the solution. This is most important, that we should not introduce further infection. The second is put 1 liter of the clean water into the clean pot, right? And before this step, we can also boil the water and cool, so that whatever the organisms are present in water, they can be killed. Then empty the whole content of the ORS packet. It is not so that we have to take the 1 glass of the water and take the 1 spoon of the ORS powder. Not like that. Into the 1 liter of the water, we have to empty whole packet for this 1 liter solution and stir up. Make it. Give the sick child as much as of the ORS solution it needs in small quantity. These are some measuring instrument which are used for making ORS, but there is no need of such instruments. So we have to give as much as the child want. ORS to be given as much as the child want, right? First of all, we have to give estimated amount within 4 hours, depending upon the dehydration. So intravenous, apart from this ORS, there is another mode of the rehydration, that is intravenous. You can give intravenous solution, IV solutions, not ORS. We have to give the ringer lactate. You may have heard the name ringer lactate, or this rhizomol type of the solutions. We can be rhizomol is also again oral solution. Rhizomol is rehydration solution for malnutrition, but ringer lactate, it is the classical example of the intravenous rehydration solution, which is to be given if there is severe dehydration. So this is ringer lactate, best available commercial preparation, and it supply sodium, potassium, and lactate. These are the dosage. No need to remember the dosage. Remember the solution, ringer lactate, RL. This is dose of the maintenance therapy for ringer lactate solution. Appropriate, along with the ORS or ringer lactate, appropriate feeding is important. So child should be breastfed if the child is having less than 2 years of the age, and supplementary feeding is also to be given to prevent the malnutrition, because you know that there is malnutrition, diarrhea, infection. This is the vicious cycle. We have to interrupt this cycle, and so for that, appropriate breastfeeding and supplementary feeding is also necessary. Chemotherapy, that is using antibiotic in case of the bacterial diarrhea. You know that most common cause of the diarrhea is rotavirus in children. So in case of the rotavirus diarrhea, there is no role of chemotherapy. But if the diarrhea is due to bacteria, then there is definite role of the chemotherapy, and antibiotics should be given according to the most common type of the infection which is present, right? Better maternal and child health services, maintain the maternal nutrition, child nutrition, promotion of the breastfeeding, appropriate weaning practice, supplementary feeding. These are also important in prevention and control of the diarrhea. No other thing. Sanitation is also most important. As you know that if you maintain the sanitation in and around the house, the chances of diarrheal episode in children decreases. Chances of getting children diarrheal disease, it will decrease by maintaining the proper water sanitation, proper excreta disposal, and food, right? Food sanitation, food hygiene, personal hygiene. This is all important for prevention of the diarrhea. disinfection, using the disinfection, personal hygiene, fly control. You know that many agents, diarrheal disease agents, particularly salmonella, this and other bacteria which are transmitted by the house fly. So fly control, if the fleas are present in our house, then we have to also make the fly control with the appropriate use of the insecticides. Immunization, as you know that infection, diarrhea, and malnutrition. This is vicious cycle. To break the vicious cycle, immunization is most important. Vaccination, right? So all the vaccines according to the age should be given to the child, and health education. So all of these are most important steps of prevention and control of the diarrhea, right? So write down your roll number and then you can leave. I'm giving you 1 minute. Write down your roll number and then you can leave.